Hi, I'm Dr. Abby Zike at Eye Care Center, and first I just wanted to reiterate, if you just watched Dr. Dobson's video, how excited we all are to start seeing you again. Myself, our staff, and of course Dr. Dobson really can't look forward to kind of getting back into things. So as she had mentioned, one of our big goals is just to keep up with social distancing and kind of limit the amount of time that everyone is in the office. And so to do that, we're trying to be really efficient and do what we can on the front end. And so normally, our technician would bring you into this room and they would explain, they gather a lot of great preliminary information for us for the exam. And normally they're very well trained, and so they really explain what the purpose of each test is. And so instead, basically, I'm going to do that today. That way, when you get here, they can really just kind of get into gathering data and the information that's needed. So the first thing that we'll do is we'll start with this instrument here, and if you normally wear glasses or contacts, you will keep those on for this. We want to see how well you're seeing in your current prescription. That being said, if you normally do wear contacts, please, if you have some backup glasses, and you remember if you'll bring those in with you. Also for our contact lens wearers, normally at some point we do have you take those off, and so normally we'll provide you with a case, but if you remember, again, we're just trying to limit contact with everything. So if you can bring your own case in, that way you just keep that with you, and then of course you take it home with you when you leave. But anyway, you'll start, you're gonna press your forehead. There's a little black bar that kind of presses in. So you'll sit in this lovely chair, press your forehead against there, and our technician will ask you the smallest line of letters you can read. And again, that's just to give us an idea of how well you're seeing currently. Also, while you're in this instrument, there's a few other tests that we're gonna do. And so we want to check your color vision in there. And so you'll see some circles that are gonna have different numbers in there. Basically, you're just gonna read them and tell the technician what you see. After that, we're really interested in, this gives us some information about how well your eyes are aligned, how well they're working together, and your depth perception. So kind of cool, but you actually see one thing with one eye and a separate thing with another eye in this instrument. So it's important that you leave both eyes open so that we can evaluate, again, kind of how well your eyes are aligned, how well they're working together, and how well your brain and visual system puts those two images and makes them one. So for example, our technicians will still give you some instruction, but you'll basically see one of them, you'll see some musical notes, you're gonna see a red line going through one of them. You're just gonna tell them what you see. And again, that lets us know how well your eyes are working together. Then from there, you'll kind of sit back. If you're wearing your contacts, you'll take those off, or you'll take your glasses off. Then you're gonna slide down to this instrument. And what this does is, it does a few things, but it is an autorefractor. And so it essentially gives us a good kind of baseline or starting point for what your prescription may be. And so the technician will direct you. They're gonna have you have a little chin rest and then a forehead rest. So you'll put your chin in the cup, forehead against the forehead rest. They may move you around a little bit, but again, you're just gonna keep your chin and forehead in contact with the instrument. And then all you're gonna see is you're gonna see a hot air balloon, and it'll go in and out of focus a couple times. That's normal. It takes about a minute for this instrument. And so not only does this give us a good idea of what your starting prescription is, but it also takes a really detailed map of the front part of your eye, your cornea, a topographical map of your cornea, which we'll review, and then we'll chat with you about in the exam room. The last test that we'll do in this room is we measure the pressure inside your eye. And so everybody has fluid that circulates inside their eye, and it has a pressure to it. And the reason that's important is sometimes if somebody's pressure is a little bit higher than normal, it can be a sign that something else is going on. Sometimes it's just something we monitor, or it may indicate that we need a little bit more information, which again, of course, we'll talk to you in the exam room. And so it is a little handheld instrument that the technician will use. They do kind of have to get in your bubble for this, but basically you might feel them, they'll kind of rest their hand against your forehead. And this just gets really close to the front part of your eye. And so you might feel kind of a little tickle in your eyelashes if it touches those. But other than that, it's not like the puff of air. You're really not gonna feel any discomfort. Really shouldn't feel much at all. And then it will give them a number, they'll record it. Typical eye pressure ranges between 10 and 20, but again, you'll hear us chat a little bit more about that with you in the exam room. And then from here, kind of one last stop before you actually get into the exam room is you'll head around the corner, and our technician will take you to take photos of the back of your eye or your retina. And so it's very important that tissue that lines kind of the inside way back of our eye, our retina, we always want to take a look at that. And so before this instrument was created where we could take photos, the only way to look inside your eye was by dilating your eyes. That makes the pupil, that center black part of your eye, larger, and then we can actually look in there with a light and a special lens. In order to do that, Dr. Dobson or myself has to get almost within inches of your eyes, kind of your face for several minutes. And so right now, we're really trying to do all we can to use technology to help us and limit, again, kind of keep with that social distancing as much as we can. Of course, there may be a medical reason where we do have to dilate your eyes. And if that's the case, you'll hear from us and we absolutely will still do that. But again, right now, if we can limit some of that contact, we're absolutely trying to do that. After that, you will be sat in the exam room where we will be in shortly. And from there, we'll kind of go through your exam like normal. Again, we just want to give you an idea of kind of what to expect so our technician can kind of just jump in and get going. Of course, though, if you have any questions at any point, don't hesitate. Please still ask them. Please ask us in the exam room. We don't want to rush you. We're just trying to be efficient with your time. So thank you so much, and we look forward to seeing you.